Good evening, everyone. Can you hear me okay if I stand this far away from the mic? You all right? Okay. First of all, I'd like to introduce Angela Sutton. Angela, can you come up here for just a minute? Everybody, this is Angela Sutton, and she's going to be presenting with me today and talking with you today. She's a member of Witnesses to Hunger and has been so since 2008 from Philadelphia. And she's been with me to the Institutes of Medicine and to the National Institutes of Health, and basically is my better half in all of the work that we do. So what we're going to do is I'm going to start out, I'm going to talk for about 15 or 20 minutes, and then I'm going to turn it over to Angela, and she's going to finish it out. And we want this to be a dialogue with you, and so feel free to interrupt us at any time for clarification, and we'll leave lots of time for a dialogue and for questions. Okay? So I'm going to start out.
Okay.
All right.
You
can stay or you can sit, whatever you'd like to do.
Which one?
Stay with me.
Okay.
Okay. If you get tired, you should just feel free to sit down.
I'm gonna be fine.
All right. That sounds good. All right. So what I'm going to talk about today, which I hope works. Oh, I guess play. Maybe that'll work it. We could just look at this slide all day long. I think I'll just use the mouse.
Yes, old school.
We'll do it old school.
Yes.
All right. All right, I'm going to talk about food insecurity in the United States. Many of you already know about it because you've seen the place at the table, and maybe you are following the deliberations on the Farm Bill, which funds the food stamp program, or SNAP, the Supplemental Nutrition Assistance Program, in other words, food stamps. I'm going to talk about the relationship of food insecurity and hunger to child health. And I'm going to share with you a screener that has already been inserted into the electronic medical records at CHOP, just down the street, and also in 3 pediatric clinic sites. And I hope maybe you could think about, maybe as you move on in your work, utilizing a food insecurity screener, and you'll learn about why it's so important to be able to utilize it and how it affects your patients in the future and currently. And then I want to talk about some ways to get involved with food insecurity and hunger beyond the clinic. And then Angela is going to talk about the advocacy work, about her own experiences with food insecurity and hunger, and talk about the advocacy work that she's involved in. Okay? Some of you may not realize, but the food stamp program emerged out of the situation of severe hunger in the United States. And these are images from a documentary that was really an inspiration for A Place at the Table, and actually there are pieces of this documentary that appear in that film called A Place at the Table. And this was a documentary called Hunger in America by Charles Kuralt. And if you want to learn about the history of the food stamp program, you can learn that actually it was legislators who learned about children dying of starvation in the United States, and also mothers dying in childbirth or from suffering from malnutrition, that children would be born with low birth weights. And one of the things that I think was so touching, was also touching to Bob Dole, who was a Republican at the time, or no, actually it was George McGovern, was this kid here who was wearing a cap. And the interviewer is saying, why are you, he was outside of the lunchroom at school. And the interviewer was asking him, why are you standing out here in the lunchroom, outside of the lunchroom where all your friends are inside? And the boy said, I don't have enough money to eat. And then the interviewer says, well, how does that make you feel? And the boy said, it makes me feel ashamed. And George McGovern, when he's talking about the history of the food stamp program, he says, it's not that little boy that should be ashamed. It should be George McGovern, a senator of the United States of America, who can allow this to happen. And he said, the very next day I worked with my colleague Bob Dole across the aisle, and we developed a modern food stamp program. Makes it sound really easy, that all you have to do is sort of shame our congresspeople into action and all will be well. Actually, thanks to the modern food stamp program, we have all pretty much gotten rid of severe hunger and malnutrition in this country. We've certainly gotten rid of kwashiorkor, which the little girl up above has. That's one of the indicators of such. But we still have malnutrition in pockets around the country, and this is not food insecurity necessarily, but I want to introduce you to the concept of failure to thrive. I think probably in your studies you've learned about it. Failure to thrive is when a child falls off the growth curve, and when they don't have enough nutrition for their cognitive, social, and emotional development, but also their physical development. And you can see it in their weight and their height. So we have a GROW clinic. We started a GROW clinic at St. Christopher's Hospital for Children. It's a multidisciplinary clinic where we have a pediatrician, a nurse, a social worker, and a nutritionist on board to talk to the families. This is one of the kids. Actually, this is a kid from Boston. There are a number of these clinics. Many of them are called the Thrive Clinic or the GROW Clinic, not to call it the Failure to Thrive Clinic because you walk into the door and feel like a failure already. But I just want you to know that this is actually still happening. It can have to do with severe deprivation and severe poverty, but oftentimes it's also associated with behavior. And we don't make a distinction, I think, as you know, between organic failure to thrive and sort of behavioral failure to thrive. It's not just a physical type of diagnosis that has to deal with the malabsorption. But it also, when children are failure to thrive or not eating well, it has an enormous amount of social and behavioral consequences for the family. It can become very upsetting. So this is a kid from Philadelphia GROW Clinic. After they get back onto the growth curve and they stay there for about 6 months to a year, then we graduate them sort of off, and we don't want to see them ever again. But this is an example of our kids. And that's an active GROW clinic right now. So you should be aware of it, and we're taking referrals from really all over the region. So I wanted to give you a sense of what's going on. With the kids that are experiencing failure to thrive, that would be a clinical form of hunger, right? And then there are milder forms of hunger when families report that they've experienced hunger, that they went hungry for a whole day. And then there's this huge area called food insecurity, and that's what I'm going to talk most about today. So I don't want you to confuse failure to thrive with food insecurity. Food insecurity is a very serious issue, but it's a milder form of malnutrition. So food insecurity is the lack of access to enough food for an active and healthy life. It has two components. The first one is enough. So that's what a lot of us think about when we think about hunger. It's like families don't have enough food. But the other component of it is a public health component, and one that's very important to you in nursing. It has to do with having enough of the right kinds of food for an active and healthy life. So you can have a family that may be eating oodles of noodles or pasta for weeks at a time every day because that's what they can afford. That is a form of food insecurity because the family will probably say that they will not see that that is adequate nutrition, and they haven't been able to have adequate nutrition because they didn't have enough money for food. Money and food, really important to remember. Okay, so I just want you to know that food insecurity is quite prevalent in the US population. All across the board, it's about 14%. That's almost 50 million people in America. For children, it gets worse, because it's now 1 in 5, where it's over 17 million kids that are experiencing food insecurity at some point during the year. And for really young children, it's even worse. 1 in 4 very young children in the United States right now is living in a household that has reported food insecurity. That's over 9 million infants and toddlers and preschoolers. I guarantee you, each one of you will see kids often that are experiencing food insecurity. And this has major social, cognitive, and physical consequences. I don't know if you all learned about Healthy People. Do you learn about Healthy People 2020? Okay, so I put that up there for you all. So you can see the disparities in food insecurity. The younger the child, the higher the rates. Female-headed households are those that report no male head of household. There could be men around and actually being the head of the household, but so the way that we study it, we call it female-headed households, have extremely high rates of food insecurity. And of course, there are major racial and ethnic disparities in food insecurity. In terms of sheer numbers, there are more white families that are experiencing food insecurity and hunger. But if you want to draw a boundary around a population and think about things in terms of race and ethnicity, in terms of the burden on the population that self-identifies as that, much higher reports among African American and Latino families. The Healthy People 2010 target was to reduce food insecurity to 6%. Well, here we are. These are the 2011 numbers, and there was no revolution. No one from the public health community actually stood up and said, this is outrageous. We haven't even touched our goal. We haven't made any progress toward our goal. So I'm putting up here the 2020 goal. Maybe you all can be watching our 2020 goal and be working towards reducing food insecurity in your practice. So just in case you didn't pick up on it in the film in A Place at the Table or didn't read the Philadelphia Inquirer back in 2010, Philadelphia has some of the highest rates of food insecurity or food hardship in the nation. At one point in 2010, about 36% of the families in the 1st Congressional District, that's the shaded area. You see St. Christopher's Hospital for Children, which the little apple is there. That whole shaded area had rates of 36%. Over 1 in 3. Among households with children in this same area, 50% of the kids, 50% of the families. The magnitude of this issue is tremendous, and it's right here and it's right among us. So I just wanted to give you a sense of what is happening in terms of child poverty in Philadelphia, just to allow you to envision the magnitude. Many of us might be Phillies fans. The Phillies Stadium can seat 44,000 people. Well, that happens to be the same number of kids under the age of 6 that are living at the federal poverty line and below. So next time you watch a Phillies game, just populate it with a bunch of infants and toddlers, and then you can get a sense of the magnitude of our issues. All right, so the health and social impacts of food insecurity are pretty severe. So food insecure children suffer more headaches, more colds, more ear infections. They have higher hospitalization rates. It affects their development. They also suffer more psychosocial problems and behavioral problems. And by that, I mean hyperactivity, aggression, not able to get along with their peers, greater need for mental health services. And also, children who are food insecure have problems with learning. They have lower scores on math and reading. And actually, food stamps can raise those scores. Isn't that interesting? So I want to introduce you to this research study that we do called Children's Health Watch. It's a multi-site study where we focus on families with young children under the age of 4. And those of you who saw A Place at the Table, I have a little cameo appearance when I'm there with a clipboard and I look like I'm a doctor. I'm a real doctor. I'm not an MD. But I'm doing my research. I'm doing my research and I'm interviewing a mom about her family, her household, and her kids. And the child, you might remember, has the nebulizer up, and she is crying. In that moment, we're doing what's called the Children's Health Watch interview, and I'm going to tell you about that. So we are in 5 sites around the country. I have 7 stars because there are 2 sites that are not active right now. But we're in Boston, Philadelphia, Baltimore, Little Rock, Arkansas, and Minneapolis. And we've interviewed over 65,000 families with little kids, over 6,500 in Philadelphia. And I want to take a step back for a second and tell you about why we focus on really little kids. And I think you probably know that 2/3 of the brain grows after a child is born. So if you look at that little graph over there, it's sort of like you can see the mass of the brain that happens after birth. It's a very critical period of brain growth. It's when the neurons are dividing. There's all kinds of pruning going on. And I want to introduce you to this concept of toxic stress. Have you heard of toxic stress? Some of you are nodding. All right, I'm going to introduce this concept to you, and then I'm going to try to do it in pictures. Basically, what you see here is a typical neuron. This is a sort of an important piece of the brain structure, and it's got a lot of synapses, a lot of things growing, a lot of information that's being shared and getting rolling. And this is a neuron that is damaged by toxic stress, which can be severe adversity. And you can see that toxic stress, which is a major form of deprivation, actually affects brain growth. And it affects the way that neurons are dividing and pruning. Remember that an infant is growing 700 neurons a second. A second. That is tremendous growth. It's an important window of opportunity. It is the most important of those first 3 years of life are the most important of our lives. So everyone in this room, including Angela's 2 children, have already lived their 3 most important years. All right, so toxic stress is frequent or prolonged adversity without adequate support. It can include physical and emotional abuse, it can include neglect, but it also includes major economic burdens, homelessness, and hunger. What does that do? It affects the brain architecture, and later on in life, it can affect the child who experienced toxic stress. They can experience major problems as adults in their 40s and 50s and 60s, more likely to experience heart disease, obesity, diabetes, cardiovascular disease. And just in case you forgot, we're talking about kids. These are some of the kids in our program called Witnesses to Hunger. These are photographs taken by their moms. They all know that their children are experiencing major toxic stress. They may not use the term toxic stress, but they want people to see that this is stressful and it's not good for kids. We know it's not good for kids. So in the Children's Health Watch study, what we do is we track the policies and programs that affect young children. So we track participation in the food stamp program, in the WIC program, which is a nutrition program for pregnant and lactating moms. We track participation in Medicaid. We also track housing subsidies and energy assistance. And what we do is we see how these programs and policies are inscribed in the bodies and brains of little kids and their caregivers. So we track food insecurity, hospitalizations, child well-being, maternal depressive symptoms, and child growth and development. And I'm cutting straight to our outcomes. As you can imagine, food insecure kids are much more likely to be sick than non-food insecure kids. And one of the things that I want you to pay attention to are the maternal depressive symptoms. That's the blue bar. Families that report food insecurity are more likely to also report maternal depressive symptoms, and they're more likely to report that they have concerns about their child's development. So the damage of food insecurity happens long before a child crosses the threshold of kindergarten. So it's wonderful to be talking about school breakfast and school lunch. Those conversations are going to start happening because the Child Nutrition Reauthorization Bill is coming up in the next couple of years that funds WIC and it funds school breakfast and school lunch. Extremely important, but don't forget about the little ones because that's where their major damage really happens. We don't just track food insecurity because food insecurity doesn't happen in a vacuum, right, Nikki? A family is not just sort of living the dream life, being able to pay their rent and their utilities, and then all of a sudden just like, oh, gee, I'm hungry. It's more of a trade-off that families have to make. So oftentimes you'll see food insecurity mixed in with not being able to pay their rent. We call that housing insecurity, or having to move more than 2 times in the year because you don't have enough money to pay the rent or pay the mortgage. And also not being able to pay utilities or having your utilities shut off or living without your utilities, living without running water, living without electricity or gas for months at a time. These 3 things are the trio of things that really can land a kid into the hospital. And you will be seeing them. And these are preventable issues. And yes, antibiotics would be great. They need it in the moment. But in the meantime, if you're sending them back into their housing conditions in which there are rodents or all different kinds of pests, or there's terrible dust, and it's freezing, and mom can't pay the bills, that kid is going to land back in the emergency room and you're going to see that kid again. There is a way to prevent this hospitalizations, and that's to focus on what some of us call the social determinants of health, right? Making sure that families have enough money for their basic needs. Basically, I want to say something else about this. When kids land in the hospital because of these social conditions, it is a waste of your nursing expertise, because these things could be prevented. So Congress has a lot of control over what families can do. So it's really important as a nurse or as a health professional to be paying attention to public policy, because they could be throwing your expertise out the window. There's no need to see these kids for preventable hospitalizations. All right, what we try to do is we publish these we publish in peer-reviewed journals, and we publish in pediatrics, and you probably had to suffer through reading some of these kinds of things. But we also publish policy briefs so that we can talk directly to legislators, so we can translate our research results, which to you probably seem very obvious. Yes, a hungry kid is a sick kid. But we have to spend millions of dollars to do this research to somehow convince them that they have to take it seriously, or more seriously than they do. So what we do is we translate these, our evidence into policy briefs. So we have one called Food Stamps Are Good Medicine, or the one that we call, our most recent one is the SNAP vaccine. So SNAP is the fancy word for food stamps, right? We try to show our policymakers that food stamps are a form of medicine. We also show that WIC protects against poor child development, and it prevents underweight. We also can show that energy assistance, that's LIHEAP, Low Income Home Energy Assistance Program, can be an important public health program. And housing subsidies can reduce underweight in kids. That's pretty phenomenal, that a housing subsidy is actually a medical and public health intervention. All right, and that's what we do. And the idea is, here's the pediatrics journal, and then we create the policy brief, and then we testify before Congress about the importance of the programs, and it all sounds really exciting and wonderful, and it can lead to policy change. And it all sounds very simple, but we have to stop right there, right? Because it's not so simple. Mostly, I have to say, because so many of our policies and programs in this country are not based in empirical evidence. That may be shocking for you to hear and to understand, but if you have the scientific evidence, it doesn't mean that you can convince people about the importance of the issue. Yet it helps. And yes, it's, you know, there are many who appreciate the science and want to move forward because there is empirical evidence. But if you can't grasp people's attention with the science, how are you going to do it? You've got to be able to communicate in a way that grabs people somewhere in their heartstrings and you can slowly play them or something, right? You've got to go for the emotional appeal that they care. How is it that people are going to care? And why do you bother to care? Do you have ways of expressing that? You know, I really care about my adjusted odds ratios, but frankly, well, the adjusted odds ratio is 73% increase of the child development of food insecurity. You've all fallen asleep, and I've fallen asleep, right? The other thing that I recognize when I'm testifying before Congress is we're called an expert witness, and it's all very fancy. You have these nice wooden chairs, and there are the people up on the dais, and then you have this nice microphone. It's got a little timer on it. It's a little intimidating. And you realize that half the people in there are asleep, the other half are on their phones, and the other people that are supposed to be in there are not even in there. The other thing is, I'm not an expert. I'm called an expert witness in front of the microphone, but I'm not an expert on hunger and poverty. Angela Sutton is an expert on hunger and poverty. Why? Because she's lived it. She knows the programs. She knows the policies better than any of us. Okay? And yet, when is she invited to testify before Congress as an expert witness? They'd much rather have the doctor, surprisingly. They want the doctor to show that they want the expertise, but then they don't follow the expertise. Interesting. All right, so we launched this program called Witnesses to Hunger. These are some of the moms that I work with. Angela is one of the moms that we work with. And the idea is that the women themselves, women and men, all caregivers, express their experiences with food insecurity and hunger and poverty, homelessness and housing and energy assistance. And they do it in their own words in a way that they can actually talk about the policies and programs that affect them the most. They work through their cameras, primarily. Each participant got their own digital camera. It was a Canon PowerShot. And then we tape recorded the interviews, and then we worked with the participants to do focus groups. What kind of exhibit do you want to have? We have traveling exhibits. Angela has given talks really all over the country. She gave a keynote speech in Los Angeles a few years ago, and they write blogs. They're on Twitter. They're out there. Expressing their sense of action and social change and trying to explain it in a slightly different way through their own expertise, through their photographs. So you can get a sense. I just want to show you some of the images. This is a photograph by Crystal Sears. She said, I want people to see it's not all that bad. Thanks to food stamps, my daughter ate breakfast this morning. But artistically speaking, you can kind of see this kid is hanging off the edge of a cliff. That bowl of cereal is holding that kid up in a way that's very precarious. I'd have to say that Crystal would agree. This is a photograph by Erica Smalley talking about the housing conditions in Philadelphia. She said, when I walk down the street, it's so depressing that I have to walk down the street, and I have to walk down the street with my two daughters, Precious and Adore. And this is what they see. And what it tells me is that no one cares about our neighborhood. No one cares about us. And then when you see that no one cares about you, then you stop caring about yourself. That is those feet over there, that's a doll. It's not a human being.
Yes. That's it.
This is a photograph given to me by Barbie Izquierdo. She calls it her neighbor's kitchen. She said, just because things look good on the outside doesn't mean that on the inside things are going well. And that things can get to be so bad that single moms especially have a really hard time asking for help. They're afraid to ask for help because it's so bad. So we happen to know who Barbie's neighbor is. She became a member of Witnesses to Hunger and has owned up to living in these kinds of conditions. She is a mother of at this time, was a mother of a 6-year-old and a 2-year-old, Joanna Cruz. And along the side of her house, on the wall, are these beautiful orange stickers that says, "I'm an ER visitor." They have those at St. Chris. I don't know if you've ever been to the, yeah, you have been because that's how we met you. This to kind of indicate I've been an ER visitor. She said, I practically live at the emergency room because my kids have colds and asthma attacks and rashes and fevers all the time, and I know it's because of our living conditions. This is a kind of deprivation that is right down the street in Philadelphia and that would never be revealed to you like that in a clinical visit. People hide it really well because of the shame and the fear of what you might do. It turns out that she had, what do you call it? A pit bull named Caesar.
Yeah.
Caesar, basically, I said, why do you have this pit bull? I'm so afraid to come to your house. She said, I keep him there because I'm afraid of DHS, Department of Human Services. Why? Because they would come and take her kids away if they knew that that was the condition that she was living in. The fear of reporting food insecurity, hunger, homelessness, and deprivation is very real. Why? Because you have really good moms that are doing their best, and the last thing that they would want to have happen is to lose their kids. That was a very palpable fear of Joanna. Of course, they're very upset with the tobacco advertising, soda advertising, and those of you who are nurses who understand the importance of WIC, women, infants, and children, and who know that WIC is so important for preventing underweight and for promoting child development. It's a great public health program, and there it is being advertised on a Coca-Cola sign. So when you say, yeah, use your WIC vouchers, etc., remember the kind of environments that your patients are living in. It's not so easy. Yeah, take your kid to the playground. This is a photo by Crystal Rodriguez. She said, there's no safe place to take my kids. And that's a picture of her child's feet in the playground next to a needle. We have a whole slew of playground pictures. I should make a whole playground exhibit. The idea is not just poor me and this is terrible, I shouldn't be experiencing this, and the end. It's really about the women of Witnesses are agents of social change. They are the ones who can directly inform policymakers. There is Angela Sutton talking directly to Senator Casey, along with Barbie Izquierdo, who's the one that showed me the photograph, and Chrissy Koch. There we are meeting with Jim McGovern, who used to work for George McGovern. Jim McGovern's in the House of Representatives. We also directly inform the press. So the women don't, I mean, when the press calls me, I'm like, okay, great, I can tell you what I think, but don't you want to talk to some people who are living in this situation? And the press really likes it. CNN, CBS, Washington Post, The Inquirer, NBC, et cetera. It goes on and on. Hang on a second. So you can learn more about our program, Witnesses to Hunger, and experience some of, you can plug in any term that you want into our website, into the gallery, and out will come a bunch of photographs and experiences by the women of Witnesses. We're going strong. We're in multiple sites. We're actually starting a new site in Northern California. And the idea is, remember, when I talked about Congress wasting your time, because frankly, they're sending those kids into your ER, into your emergency room visits, because they're the ones who are pulling the levers for who's on food stamps, who gets housing subsidies, who gets energy assistance, and who can get minimum wage or beyond that. Let me talk about a way that you can think about talking to your patients. These are 2 food insecurity questions that we have tested for sensitivity and specificity. And I'd be happy to share with your professors the peer-reviewed article. These 2 questions, a yes to either of these 2 questions is a very good gauge of whether a family is food insecure. Once you find out that a family is food insecure, you can ask, are you on food stamps? Are you getting WIC? Do you know where the food pantry programs are? Do you need a voucher? Do you need a $25 gift card? Do you need some food right now? Can I write you a little script so that you can go and eat at the hospital cafeteria in the moment? Those are some things you can do. You can also have a farmer's market in the hospital that takes EBT or the food stamp program. So the questions are, we worried whether our food would run out before we got money to buy more. Was that often true, sometimes true, or never true for your household in the last 12 months? So it's really actually quite broad. In the last year, did you just worry? And that worry is an indicator of food insecurity. The other one is the food that we bought just didn't last and we didn't have money to get more. None of them are asking, were you hungry? One asks, were you worried? The other one is, did you run out of food because you didn't have enough money? Anyway, great sensitivity and specificity. It's being used at CHOP. And after they ask these questions, they ask about food stamps and WIC and try to get into the family's life a little bit more to learn more about how they can help that family to prevent another hospitalization. So there's a really nice report that if you just plug it into Google, you can find it. It's called Ways Hospitals Can Help. I suggest that you have a look at it and bring it to your colleagues to think about it. And there are some other things that you can think about, and I don't want to get into it too much, but basically it's a triangle of health and well-being. For health and well-being, you also need economic security, and the only way you can create economic security is if you have opportunities. So basically there are 5 domains in health and well-being. That's dealing with nutrition, housing, energy, health, and safety. In economic security, it's being able to have a good paying job and having the skills to get paid twice the minimum wage, if not more, or raising the living wage, and also having access to a bank account and assets, opportunities for education, not only for the moms and caregivers, but also early childhood education for the kids. And I'm going to stop there and turn it over to Angela Sutton, who's going to explain to you about her life, how she got involved with witnesses, and what she hopes you think about. And I'm going to change my mic.
Do you have a pocket?
Let's see. Wrong clothes today.
That's okay. You can clip it onto.
The belt. And clip this one onto the sleeve. Hello? I don't hear me.
Well, you don't hear you because you're talking to the dude
Oh,
on the
sorry.
video.
Was that loud? I apologize.
Do you want me to stand up here?
It's up to you. You can stand. You might be tired. You might want to sit.
No. You stood for me. I'm standing.
Oh, okay. Okay, first of all, good afternoon, good evening, because it's late. First of all, I want y'all to wake up. Wake up, wake up, wake up. Stretch, move your arms, do something for me, laugh, joke, stretch out. Because I was a student and I know. I understand. Move your neck a little bit, get a little unwound, get uncomfortable. Okay? First, my name is Angela Sutton. I was honored that y'all asked me to be here to speak to y'all. I'm going to give you the reality of life. I'm going to take away the school material, stuff that you learn, because you're not going to really know unless you hear it from people like me. Let me first start off by saying, when y'all hear this story, this is not for y'all to feel sorry, to be hurt. I don't want to make y'all down and y'all crying when you go home and, oh my God, we got to make a change because I want y'all to make a change because we're trying to prevent, okay? So when I tell you my story, I'm here, I'm fine, everything's going to be okay. We're going to breathe, okay? No, because I'm going to just be honest, because I'm going to be honest with y'all. And no question is taboo. If you have a question, I'm open to any question. I'm honest. Just be careful what you ask, because you're going to get the truth. If you don't want the truth, because the truth ain't meant for everybody, as we can see with society today. So, my name is Angela Sutton, and you might hear this too. Let me say this. I am also known as Nike. If you hear somebody say, hi, Nike, that's me. It's okay. You can call me Nike or Angela, whatever you feel free. I'm like one of the fellas, one of the students, nobody special. Feel comfortable to talk to me Address me as Angela or Nike, okay? All right, now, I'm a mother of 2 beautiful, beautiful children. They are my world. This is my little one. This is Aeon. We call him Dr. Sutton because he's trying to be a doctor. Say hi, Aeon. Hi. And then I have my oldest son with me as well, Jazier. That's the one that wants to be an interpreter for United Nations. Say hello. Hello. Today I want to give you a little taste of poverty firsthand. I'm going to give you a little history about me. I'm 39, a mother of 2. I'm a survivor of gun violence. I have been shot at the age of 14, stabbed by the age of 15, homeless by the age of 16. The reason why I was homeless is because my biological father was raping me. And I felt like the streets was better than being constantly being abused. The reason why I feel that I went through so much turmoil as a child is because of the food insecurity, the economical hardships, people lack of understanding, and then drugs became a part of my father's coping method of feeling less than a man, and then it went from there as a trickle effect. I never finished high school, but I went to Drexel University, and I'm 45 credits away from my bachelor's. Oh, thank you. That was by loop. I went to take my girlfriend to take the test to get into Drexel. I had to take the test so I could stay and be her ride back. And come to find out I was smarter than I thought. So I got accepted, she didn't, and she forced me to go. She was like, I didn't get accepted, you gotta go. And I was scared. I flunked the first year tremendously, had no clue what I was doing. So I understand the want. That's why I told you to stretch. So, food insecurity. I have struggled over the years to take care of my children. This is my baby boy. When he was first born, I had to move out of the situation because there was a lot of gun violence. So I took the first available place I could find that I could afford, not knowing that it was mice infested. This is him breaking out because he's allergic to something, I don't know, maybe your nurses could help me, that's on the mice skin. It's like a wax film that they leave behind like a trail. And what happens is when the baby was on the floor and stuff, his skin was contacting, and that's all the breakouts. He just woke up one day breaking out. This is where I was sleeping at. Come to find out it was dead mice in the couch. I reported to L&I. I tried to let somebody be held accountable for it, and I got no help at all. That's why we wound up in St. Chris, where I got to meet Mariana later on down the line, because they asked those questions that she just showed y'all. And that is very important to choose your questions wisely, because you don't want to offend anybody, because it's a real traumatic experience, the know and shame that comes upon you when you feel like you can't take care of your children, on top of the fact you don't want them to be taken because you are a good parent, you just have lack of resources. This is me, different things that come from food, not being able to feed your children, and hardships and stuff, depression, poor physical health, and overweight. Come to find out, as nurses, y'all might know this now, I didn't know, you can be fat for not eating. I never thought that you could actually be fat because you don't eat. I never heard of it. It felt like I was like, they lying. There's no way I should be skinny, but I'm fat because I don't eat, because I will feed my children instead of myself, so I will sacrifice meals. So what tends to happen is your body stores it as fat, don't know, go into something called starvation mode, don't know when the next time it's going to eat. So for me to actually, the way I'm losing weight, I have to eat 6 times a day. Remarkable, right? Never thought of it. This is well, he's much bigger now. My oldest son, this is some of the things I have done to help them deal with their hardships. I had put them in martial arts because they had a lot of anger issues. And to get them to understand that it's not always going to be this way, I need to take all that negative energy and put it into something. So when you're talking to your patients, always try to find an outlet for them, because sometimes you need an outlet, a video game or something, to relieve tension, and it'll help some of the stress that you go through. So this is him when he was practicing for his, I think, yellow stripe at that time. This is some of the advocacy work we did. We are real good friends with Mr. Casey. He owes me a basketball game still, but this is some of the proud moments of my life where my life started to change when I was able to have a voice. A lot of your patients that you're going to come across don't feel empowered. They feel ashamed. They're going to feel low self-esteem, depression. They might be obese, malnutrition, or they might just feel like they have no more hope. As nurses, the first contact they meet with you in the ER, I think, is to have a bubbly face, to speak the language of your patient, whoever they might be, meaning that some patients need general care. They don't need to feel like y'all better than them. Come to them as a student versus a teacher. And sometimes that'll open up doors where they'll feel like they can trust you so you can know what's going on and you'll be able to help them better and be more effective. But these are some of the, this is our power picture. When we were sitting there upset with Congress because they don't want to let us testify, and we need y'all to understand there is a gap between the people that's suffering, the people that's empowered, and the people that helps the people that's impoverished. Like, it has to be a connection somewhere. There's too big of a gap. The nurses should be able to be with the clients should be able to talk to legislators. It's too much of a bridge, so nobody knows what's going on, and nobody's helping nobody, and nobody's being held accountable. So as nurses today, I would like for you to take a moment when you do your job. If you are not a people person, if your love and your heart is not there, please change your major. And I say this because there's no need to waste your money. There's no need. Your job is to make a difference in everybody's life somehow, some way. Even if you could save one child, then your tuition is worth it, because you pay an arm and a leg not to go there and be mean and not to get nothing done, if that makes any sense. Okay. Because I have came across a lot of mean nurses in my day, and I don't understand. I think y'all need one-on-one classes with that. This is the Beyond Hunger conference that we had. And we did this because we wanted an opportunity to network. Networking is key. It's not always what you know, it's who you know sometimes that can make a difference. Some of the connections that you might come across, always be willing to network with your clients, meaning that if you know a food pantry that's available, if you know grants or scholarships or anything that can make a difference in their life to make it a little bit more easier, then do that. Network is very, very good key. This was a good, my son. Okay, I'm very proud of my children. Like I said, I had a hard time feeding my children. That's why I would sacrifice my meals for my children. And I'm glad I did, even though now they don't play that because they're older and they tell me off. But at the time, it was worth it because I knew how crucial their brains are. I nursed both of them for 2 years, the first 2 years of their life. And both of my children, I'm very excited to say, I had them reading by the age of 3. My youngest one, I'm all about education. My youngest one is reading on an 8th grade reading level. He's 6. My oldest one, he's learning Chinese, and he's writing it. Like, he's actually doing Mandarin. Like, I don't know what it means. I don't know what it say. I can't help with Chinese homework at all. He's on his own. However, it enlightens me to, if y'all keep talking to your clients, it helps empower them. It helps them feel like they can accomplish something. It makes them feel like the children are worth fighting for. You gotta give that fire back to some of your clients, because what's gonna happen is they're gonna come to you depressed, they're gonna feel hopeless, depressed. What's the point? They're ready to give the children up, but you gotta give them some spark of hope. Even if it's just a hug, a smile, I'll pray for you, whatever, it makes a difference. And what happens is it gives them, because somebody invested in me. And when they invested in me, it helped me to invest in my children. This is my son speaking at the Beyond Hunger Conference. He has just went on MSNBC, the Senate. Even though he's not a teenager, he was on the Teen Summit talking to the teenagers. I'm not ready. I got 4 more months. This is one time I got invited to go to see Senator KCB, his inauguration, but I couldn't go because I didn't have a sitter. I sent my son, and he represented me very well, and he got the honor of meeting the Vice President, Mr. Joe Biden himself. This is him taking pictures with, I I turned it off. He was taking pictures with a lot of professionals and stuff, and you have to get the children more involved, meaning that once they see that they can make a change, because they want to do big things. My children are very focused in helping others, and I'm very honored that they are the way they are, but it took somebody to invest in me so I could invest in them. And that's what I mean by there's a change of command, and there's a gap, a bridge in communication, networking, and people feeling their worth. So your job as nurses is to be loving, caring, nurturing, compassionate, understanding, and your job is very overwhelming. And y'all underpaid. Y'all do more than the doctors, and I think the salary should be switched. We could fight for that too. We could try in Congress to raise some cane for y'all if you want, after we get this together. But I'm gonna leave some questions open for y'all, but some of the solutions, like I said, is networking, finding out your client, trying to find out what can you do to better the situation, and also take children into consideration. What are you working with, and not talk down to them, but talk to your client, because that's what's going to make the difference of them opening up and trusting you. That making sense?